Hi, Erkan. Welcome. Better. Hello. How are you? Hello. Hello. See if more people come in. Close this door in the meantime. It's a slow day today, I guess. So I guess I'll just introduce myself. While we wait for people to come in, my name is Marisol, and I have late-stage Lyme disease. I was diagnosed about 4 years ago, 4.5 years ago, and I have late stage severe neurological involvement with my Lyme disease. If you want more information, you can visit my UCaring fundraising page, ucaring.com/Marisol has Lyme. And there's more information about my own personal journey with Lyme disease. So today, hi Halligan, welcome. How are you? And there's a link also for my UCaring page in my bio as well. I'll be accepting donations until the end of May, so the fundraising will close May 31st. So today, as you guys saw the title of my scope, it says, I wish I had cancer. And this is something that a lot of people, thank you for the hearts, a lot of people with Lyme disease, and I'm guessing other chronic illnesses, they are guilty of saying this. And I know I've said it before in the past, during times when I've been really upset, I've said, I wish I had cancer. I wish I had cancer because at least, I'm going to die, or the cancer will be cured or treated. And this is actually very, very false. It's not something that anybody should be saying, but it's also based in the false belief that cancer is either going to kill you or you're going to survive it and then you're fine. The reason I'm talking about this today is because I've mentioned before a few times that I have a friend who is getting a double lung transplant. He's actually getting the lung transplant as we speak. And he had leukemia, I think like 15 years ago. And I believe he got a stem cell transplant, but his body was never the same after that. He continued to struggle with his health. I think as a result of I don't know if it was his chemo treatment or the stem cell transplant, his lungs started deteriorating. And so even though he was in remission, he no longer had leukemia. He was still very, very sick. And that's something I think that most people don't know about cancer, is that even if you, quote unquote, beat the cancer, it doesn't mean that the cancer doesn't take your life away, or that it didn't take your life away. So, I've spoken to other Lyme patients, and, I've heard them say, multiple times, I wish I had cancer. I would rather have cancer and die than live like this, than live with this disease. And what they don't realize is that people with cancer, even if whether they die or whether they beat the cancer, hi Jessica, welcome, they still suffer a lot and they are still very, very ill. So it's very false to say, I wish I had cancer. Hi, how are you? It's insensitive, and it's also ignorant, because people with cancer continue to struggle with their health long after their cancer is in remission. So, for example, about 1 in 2 Americans have a chronic condition. That would be about 133 million Americans have some kind of chronic illness, chronic pain, some kind of chronic condition. 9 million of these people are cancer survivors with various side effects from treatment. So the next time you say, I wish I had cancer, really think about what you're saying. Hi, hello. I used to be married to an Egyptian person, actually. um, so 9 million are cancer survivors, and they continue to struggle with the side effects of, chemotherapy, radiation, stem cell transplants. So just because you had cancer doesn't mean that, your problem, or just because you beat cancer doesn't mean that your problems go away. Thank you for inviting followers. Like I mentioned, my friend who is currently undergoing a double lung transplant. Hi, Mark. Welcome. My friend and my uncle are two of these people that continue to struggle with their health long after they have been in remission from cancer. Thank you for sharing. Hi, Mark. How are you? Like I said, my friend, he's currently in the hospital right now undergoing the lung transplant. That's very scary for him and his wife because there are so many things that can go wrong. But he's been struggling with his health for the last 15 years. He beat leukemia, but, he had this other effect from the stem cell transplant and from his, from all the other treatment that, he's never been able to live a 100% full life. And he's just a little bit older than me. He's, I believe, 34. And I'm going to be 32 this year. So he's very, very young to have to be dealing with this kind of stuff. My uncle is older, and he had cancer as well, but he, his cancer hasn't come back, but he's been through multiple surgeries. Also, I believe for the last 15 or so years, has struggled with the side effects of surgery, has recurrent infections as a result of probably the radiation and all of the surgeries that he's had. Antibiotic treatments. Actually, both my uncle and my friend have gone through long-term antibiotic treatment just like me. Actually, longer than I have. My friend with the lung issue was on antibiotics for a year. So that goes to show you that just because a person no longer has cancer doesn't mean that they don't have long-term chronic issues as a result. So, when I used to say I wish I had cancer, I never stopped to think that cancer really isn't any better. And there are also people that have cancer for a really long time. Even if they don't go into remission, they just have cancer and they just keep treating it for a very, very extended period of time. You could have cancer for a really long time and still be alive. But it doesn't mean that you're okay. Yes, I've said it in the past. I know that there was another woman that I met at the doctor's office who would say that. She was like, I just wish I had cancer. It would be so much better than this. And I think it's just those of us with Lyme trying to emphasize how hard Lyme disease is to have. And in all honesty, all of these illnesses are difficult to deal with. Even if you're in remission from cancer, you're still going to have long-term side effects, infertility, all kinds of things that are going to affect your life. And like I said, just because you beat cancer doesn't mean that you don't lose some of your life. Hi, Adriana. Welcome. So some of the long-term effects, thank you. Some of the long-term effects of cancer treatment are, weakening of the heart muscles, which of course is going to reduce your stamina, coronary artery disease, heart arrhythmias, hypertension. I will keep this up for replay. Lung problems, difficulty breathing, inflammation of your lungs, joint pain, the thinning of bones, neuropathy, hearing loss, learning, memory, and attention problems. Oh my goodness. Wow, that is crazy. Dental problems, eye problems, digestive problems, depression, anxiety, isolation, post-traumatic stress, fatigue, the list goes on and on. And some of you might be familiar with some of these symptoms because of your Lyme disease. And these symptoms also apply to people that have quote-unquote survived cancer. So it's not just something that is isolated to those of us with Lyme or lupus or, people with cancer that have survived cancer also have this as well. Hi, Practical. So, I just kind of wanted to talk about that. Like I said, my friend is currently in the hospital right now, and he's receiving his lungs, and I'm hoping that everything goes well. But that's sort of what inspired this scope. I was gonna scope about something else today, but just knowing, and I've known him for about a decade, and he was sick before I was, and I didn't know that I was sick at the time that I met him. But just seeing how he's kind of gone through life, being young, he was in his 20s, his early 20s. It says it on the title because a lot of people with Lyme disease say that they wish they had cancer instead of Lyme disease. But it's very false. It's very ignorant, it's insensitive, and it's also inaccurate because there's about 9 million cancer survivors, Americans that have survived cancer, and they still have side effects from treatment for the rest of their lives. And when we say I wish I had cancer, we never stop to think that just because a person has cancer or had cancer, it doesn't mean that they're okay. Your cancer can be in remission, but you can still lose your life to cancer. And my friend is one of these people. He ended up having really severe lung issues as a result of his treatment and his stem cell transplant. And he's actually in the hospital right now receiving a new set of lungs, which is extremely risky as well. But, I've seen him struggle. He's been struggling a lot longer than I have. And, you think to yourself, just because this person is in remission, they must be fine. They beat the cancer. They're okay. And he wasn't okay. He's been sick the entire time that I've known him, and he struggles. I mean, the last time I saw him, he walks like an elderly person because he can't catch his breath. And sometimes even when he would talk, he had to kind of stop and pause and catch his breath. And this is somebody that's 34 years old. I'm not talking about, even a 40-year-old person. And so, when we say that, and I used to say that as well. I used to say I wish I had cancer because at least I would either die or I would be treated for the cancer. But it's not, it's so false, because just because your cancer is in remission doesn't mean that you're not still chronically sick. And all of those symptoms that I mentioned, those are symptoms that people that have survived cancer still have long after their cancer. And a lot of them are also applicable to Lyme disease, hearing loss, learning, memory, and attention problems. Thank you for inviting people. Dental problems, eye problems, digestive problems, all of those things, they can be, they can apply to Lyme disease, or they can apply to people who have quote unquote survived cancer. So, I wanted to talk about it because of my friend and sort of dedicate this scope to him because, he's suffered with this for such a long time. And, it was really eye-opening to me. Hi, Luna. Welcome. It was very, very eye-opening to me that he was still suffering long after, his cancer had sort of gone away. Yeah, I really hope. I haven't heard anything so far today. I know he went into surgery last night. So I don't know how he's doing or how things are going yet. His wife is sort of keeping us posted through Facebook, but, of course she's also going to have her own things to focus on. So I'm just keeping my fingers crossed and hoping that everything goes well. But, I just wanted to raise awareness about this because I didn't know either. I didn't know that people, people who had survived cancer still have these issues. Yeah, I don't know yet. I don't know what the status is. I know he went into surgery yesterday evening. And I'm guessing it's a really long surgery because it's a double lung transplant. So, just keeping my fingers crossed and hoping for the best. But he had leukemia 15 years ago, I think. So yeah, it's really intense. It's really, really intense. And, my heart goes out to his wife. His wife is younger than we are. She's, I think, 28 or 29, something like that. So she's, her life is just getting started. And, she married him knowing that he had all of these issues. And, I really admire her. Yes, she's a big-time trooper. She's amazing. But anyways, the dog is starting to bark. So I gotta go. But, if I hear anything, I'll come back on and I'll do a special report or something. But anyways, check out my YouCaring page. The link is in my bio. You can check out my YouTube videos. And follow me on Twitter, HotSun100384. And I'll be back tomorrow with another broadcast. All right, thank you guys. Thank you so much for the hearts and for sharing. I'll see you again tomorrow.